Good afternoon, everybody. I'd like to call to order the Behavioral Health Subcommittee of the Incarceration Prevention Reduction Task Force. Today is December 15th in Whatcom County, and it's kind of gray and drizzly. Thanks to the folks that are with us today. We don't have a quorum yet, but we're going to go ahead and get started. I'm going to start first with our call to order. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders past and present. Please take a moment to consider the legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. All right, so first off, Eric, thank you for joining us today. I heard late that you were going to be able to join. And in deference to your time, if you'd like, we would love to hear from you early, but are you waiting on anybody, Heather, or nope? Okay, not waiting on anybody. If you're ready, we could move you first and then we could do other committee business after, if that sounds amenable to you.
Sure, that's fine. So I'm not really sure exactly what you're looking for other than just a rough update. I can tell you a few things about LEAD and how things are going. I can tell you that it's fully operational now. I mean, we are out in the community and we are engaging with people. We have 5 case managers who are actively working with people, not only asking them to participate, but actually getting people participating in the program. And it's my understanding at the last point that I've been given data about it, we've had 35 members. So people are engaging in the program. Wow. And they're getting full wraparound services at this point, with meeting people with where they're at. And things are progressing well. I can tell you that as part of our grants, we're required to have a number of meetings, and the meetings that we have are to make sure that stakeholders are engaged. And I think we've done pretty well at that. The city has been working well with us. EMS has been working well with us. We've been reaching out to community members and letting them know about the program. Things are, and I also wanted to mention that not only the city of Bellingham, but we've had agreements from every small city in the county. And they're all the cities are working with us and sending us people who they believe would be appropriate for services. We're getting kind of a push from Dan Hamill to make sure that we had a large and a big number of people, so we can tell the community that we're succeeding. And to make sure that something like that happened, Vanessa just sent out a memo to everyone in my office, and next thing you know, we had 11 people that were referred to reach out to for a lead, and that's from people who are currently being prosecuted and can possibly do some other alternatives. At least that's in our mind. So we're attempting to engage those folks as well. So things are working really well. We're hopeful that we're going to be up to 100 at, what was your deadline, Dan? What was your deadline for that?
Tomorrow, I think it was tomorrow.
Well, we're working hard to meet Dan's deadline, and that's what's important.
Well, Eric, you've touched on part of it. I think one of the things when we talked a little bit about, because we understand kind of the architecture and what some of the program goals are, because your staff have come and we really appreciate that. We were curious about good things, and I'm hearing good things, which is super about early implementation. This committee was also interested if you ran into roadblocks that it might be helpful with, or things that we could take to our respective organizations. So if there were any things that weren't going absolutely amazing and this committee could be useful, that was another thought that we had. But really quick, before we touch on that, you did mention how to get in. And I think that's one of the things is how does somebody access? So I'm hearing a lot of partnerships with small cities, with Bellingham, with the county sheriff's department, which is outstanding. Could you describe briefly, if you're not, from one of those official sources in the process of maybe being prosecuted, how might one get referred to LEAD?
So we have a working group that takes in referrals, and the referrals can come from virtually any source at this point. And we're accepting them from anybody in the community. And our points in our office are Prosecutor Dave Graham and Vanessa Martin, and that's our points for the committee anyway. And they take referrals and they run the information about the individuals through that committee, and they make a determination whether that person be suitable for LEAD. A lot of the things that are considered are, whether a person has the kind of crimes that might be dangerous to the community, or whether or not they might be someone that could be helped by the services that we provide. And anyways, those kinds of things are discussed, and there's a consensus approach. It's not it's not one person makes a decision, but from all the members in that group, there's a consensus, and they make a determination whether to admit the person. And again, so far, people are getting admitted. Occasionally, people are told that they cannot be members of LEAD because they are considered too much of a danger. But yeah, we're accepting referrals from everybody. So Mike, if you had somebody from Opportunity Council who you thought would benefit from getting some services, and those services that you believe would keep that person from getting involved in the criminal justice system, we would love a referral. And same, Mike, you probably already know that, but anyway, we're accepting referrals from everyone.
Outstanding. If you had to characterize some of those 35, I think you have so far, which is amazing because you just launched in like late October, early November. So that's outstanding. What is one of your most common type of crimes? I mean, I think some of us thought of when we know of like Seattle programs, we think, well, this is really going to address low-level drug charges or repeated theft or something. But maybe in your words, what's kind of coming up for those folks, those 35?
Well, so that's really kind of hard to say, and it's a good question, but it's hard to say. It's our people are people that are deciding that they need services. And they have been involved in criminal justice in the past, and we're thinking that if they get services, they won't be involved in criminal justice in the future. So it's not really, it's hard. We're not really saying this is their crime or not. It's just people who have been involved in the system, and we're hopeful that services will keep them out of the system in the future.
Okay. And I want to open it up too to any other committee members because I'm just peppering with my own questions. So I just want to stop and pause very briefly. Dan, Mike, Stephen, Heather, Mayor Fleetwood, Arlene, any other folks with questions before I pepper with more?
Yeah, I'll jump in real quick. Eric, you kind of touched on this a little bit when you said, Mike, if you got somebody from Opportunity Council, they could be referred. So we're calling that a social contact. Maybe just kind of elaborate a little bit on that, because I think yeah.
Sure. Right. So right now we're working on a social contact model where case managers will reach out to individuals and ask them if they like services, and they're from the after getting referred, after a process has gone over where we've made a determination that they'd be suitable for the program. So a case manager then go out to the community and ask the person, would you like to be involved? And would you like to get some services? And, that's sometimes a hard no. And oftentimes, I don't think so, not today, that kind of thing. And the case manager will keep at it. They'll go at them again and again and again, and hoping that the person will want to get involved and get the services that they need. Because, we know they need services out here in our community. We're using this model right now, and at some point we're hoping to use a more of a direct diversion away from the jail. And that's the way LEAD originated. LEAD was originally set up in Seattle, where a law enforcement officer would meet someone who has just committed a crime, and they would ask them right there in the field, would you like services today, or would you like to go the traditional route and go to jail? And of course, right then people were more interested in getting services than going to jail. And then they'd get connected with a case manager right, immediately. It could have been in the middle of the night. I'll tell you that Seattle struggled with that plan in the beginning. It was difficult to have case managers working 24/7, and it was difficult to have for law enforcement officers to believe that they could have a good warm handoff when they needed it. So with that in mind, the LEAD program kind of developed for new cities and counties that have implemented it. The program starts off with social contacts, and as it grows, then direct diversion will be available. And that's our plan. We have a fairly robust start here for our LEAD program. I can't say enough about Vanessa Martin for putting this together and getting the grants that she did. We have a pretty darn robust program that people are envious of from other places in our state. A lot of counties have started with just a grant from the state. Of course, I think we have both grants from the state as well as the federal government, making ours a fairly robust program.
Mm-hmm. Oh, that's outstanding.
I
think his hand up there.
Yeah, thanks, Mike. I just wanted to comment, Eric, as we kind of get this moving down the road, one of the opportunities I see from EMS is addressing a bit of the opioid issue. So I can imagine one of the things I'd like to get into play next year, if possible, is a diversion from the field to the crisis stabilization facility. So that sort of looks like a paramedic going out, going on the call, reversing the overdose, but having a community paramedic and maybe even the social worker come in on that call in a response model. And maybe that's the day they go to get help. And I can also imagine in that scenario that if a person had an ongoing drug problem, especially if it was an opiate or meth or some sort, they may have had some law enforcement stuff hanging on them as well, court stuff hanging on them. So part of the stabilization is that we can have that conversation, divert to the CSF, and then I'll also use the LEAD program to keep stabilization. I see a great warm handoff on a patient like that. So just as we move into next year, I'd love to keep that in mind.
Right, absolutely. That's a great comment. We've been thinking about how we could use the Crisis Stabilization Center as well. We were hoping that would be something available to LEAD.
Eric, I joined a little bit late, and so maybe I missed this and I apologize. Could you describe the team that makes the admissions decisions?
To some degree, I mean, we have a number of members who are involved in it. We have the prosecutor from my office, Dave Graham, Ryan Anderson from the city is involved. I know that Vanessa's involved, the public defender's involved. We have case managers involved. I think it's not something that's hard in stone, it's set in stone, but we have some core members that typically show up. I forgot to mention law enforcement. Of course, they're part of it. I know that Chief Gum regularly attends, and Keith Johnson from the city of Bellingham. And that's generally the core members that show up, and others may appear, such as other officers from other jurisdictions who want to come in and talk about individuals that they believe should be part of the program.
So I appreciate the value of flexibility. One of the things that structure also results in is perhaps challenges to uniformity of decision making and consistency of application of criteria. And I'm wondering what you think of that issue and what you're seeing in the early stages.
Right. So I can tell you that that a core member, the core members are the people who are voting on in developing consensus on who should be admitted, and then there's other people come and go, who are wanting to present. So I think there is a certain amount of uniformity. I can also tell you that that LEAD has adopted the GARE program so that we can make sure that we're looking at people through a racial equity lens. I think a number of us heard Mike Parker talk about that, and we decided that would be something that would be appropriate for our system in LEAD as well. And so anyway, I just wanted to let you all know that.
If someone has a referral, where should they call first?
So, that's a good question, Arlene. I started to answer that before. It's in my office. I know who to contact. I know that it's Vanessa or Dave Graham. From outside, I know that Chief Gum from the Sheriff's Department and Keith Johnson from Bellingham Police Department. Outside of that, I can't really tell you, though. I can't give you the answer.
Heather, did you have a question as well? I thought I heard you start to speak.
Yes, I'll be joining you visually in a moment. But but I wanted to share, I checked in with Melora and I joined a little late too, so forgive me if I repeat anything, but I thought it might be nice to invite her to a future meeting to share more about the clients and the needs that she's seeing and give a robust update. But she shared with me just some high level things that I think the committee might be interested in knowing as we tee up for that, if we do that in the future. She said that the LEAD program is fully staffed with 5 intensive case managers and a supervisor. Capacity will sit at 75 to 100 LEAD members across Whatcom County. She said they've already processed over 60 referrals, most of those coming from BPD and the Sheriff's Department, but also some social service agencies and other smaller law enforcement departments such as Everson and Linden. It looks like there's 20 actively enrolled clients currently, 18 of whom are in outreach status and trying to connect and build rapport. And there's 20 pending referrals. Many of those folks are in specialty courts or have left the county, or it says, or there's a current case and we are waiting to see what the charges are. For example, will they be going to prison? 6 referrals have been denied due to violent crimes such as assault, murder, current gang affiliation, and 2 unfortunately deceased before enrolling in the program. So those are some summary statistics to share that the committee might be interested in knowing. And I think it'd be really awesome to have her come and share more at a future meeting, especially as, one of my big takeaways is, as you know, especially you, Dan, now it's going to be your turn to tell me to stop talking, is what are we diverting people to? Do we have the treatment capacity in the community to adequately refer people? And I think that's part of our committee's scope.
Heather, thank you for that. And just before getting on this call with you all, reached out to Melora, who I think will be able to come in January, depending on when this committee determines its January meeting schedule. So thank you for that suggestion. And Melora is super willing, which is great. They just couldn't be available today on the short notice. And Heather, you're right. I think that's some of the details that we were looking, and Eric was filling in a lot of those. I had a different question, and maybe this is not a population that you all thought of, but I guess one of our longstanding members on this committee is Byron Mannering from Bridget Collins, and a lot of the folks that they work with, they're families, but they're criminal justice involved, right? And so I wondered what that might look like. Would a family member or a person with kids be able to be served in a LEAD type program? Or is that something that wouldn't be considered?
Yeah, they might. It kind of depends on who they are and what they've been doing. I can tell you, you asked about referrals, and I said that we had a number come from my office. 10 of the 11 that came from my office came from our victim witness unit. And what they were looking at was there were victims of crime who were also engaged in other, criminal activities that, could be supported by LEAD. So it was kind of interesting to me that we were trying to support victims and get them services and wrap around services through our LEAD program, which it was kind of cool. Anyway, so Mike, I guess the answer is it's possible depending on who they are and what they've been involved in.
Okay, there's nothing to preclude that from happening, which is outstanding because that could be key. Dan?
I don't know if Heather or Eric, you can answer this, or maybe it's a Melora question. I'm curious as to drug court. We have a mental health court at the city of Bellingham, and the drug court housing is going to be complete at some point in the near future. I'm just wondering to what degree LEAD interacts or does not interact with therapeutic courts.
So currently, there could be some interaction, but right now they're absolutely separate programs. We've had some, how can I say it? The leadership is somewhat commingled with drug court and our LEAD policy meetings, as well as our work groups. And that's Dave Graham. Dave Graham works in both drug court and LEAD. So there is an opportunity there. I can tell you that drug court, there's been some referrals from drug court into LEAD, which is kind of interesting. You're trying to decide services and what's appropriate, and we're still kind of trying to sort that out. you know, I can see some reasons why we might want to give services to people who are currently in drug court, because it might help them do better in drug court. But, you know, then the other side of it is, you know, gee, they're already working in a program, and, you know, do we want to exhaust, you know, or take away someone else's opportunity to be in the program when that person's already in another program? Anyway, we're kind of trying to work out the details. Frankly, I'll tell you, I'm leaning towards giving people in drug court more services to help them be successful in drug court.
That's outstanding. Thank you for that answer. Just really quick, Dan, you alluded to drug court housing. So I believe you're talking about the recovery house on Girard. And they're picking out furniture, which is a really good sign. So I think April is still a tentative date. As with things during COVID, everything's nuts, including the construction schedule. And of course, we'll need sign off. So that'll be interesting to see what it looks like to get a behavioral health facility signed off on during pandemic. But so that is coming on board. And for those folks that don't know, it's going to be 24/7. And they will serve folks with co-occurring disorders, essentially housing, and it's meant to be kind of shorter term in nature, although there's not a hard and fast deadline to my knowledge. But to Heather's question, this is an age-old community question that we have to figure out, and we haven't had this option before. So I'm excited about diverting two can now include a house on Girard that was not being utilized for anything but one person under a porch. And it's exciting to see that program. So Lifeline Connections, which is going to be the operator, Opportunity Council is going to own and manage it. But the operators, Lifeline Connections out of Vancouver, Washington, behavioral health, they do a full range of services and are very deep in substance use disorder treatment, as well as those with co-occurring disorders. So we're excited about that asset.
Mike, we're talking about 16 residents, right?
Yeah, that's correct. So there's two buildings on site. One will be the spot where people live. The other is an administrative building. Food will be prepped off site and then brought. So people get, 3 meals a day. There's services on site. There'll be recovery groups, medication lockup. I mean, this is really just a key spot. And I can see it, what Eric was talking about or Heather was talking about, where people are coming right out of an opportunity or right out of an institution is just ideal, because the people most people don't have things lined up or a house to go back to. So this will not only provide that shelter, but more importantly, clinical services provided on site, in addition to housing. So yeah, 16.
Can I speak to Heather's point real quick? Heather, I totally hear you. The divert to what? I remember you and the whole group talking about this, probably a couple of years ago now. I think there's got to be concurrency with programs like LEAD and what we're doing, like drug court housing, recovery house, like crisis stabilization center. There's so much more work to be done. And I think that the Incarceration Prevention Reduction Task Force has a role to play when it comes to advocating at the state level with our representatives. Now we have four. We have four representatives in the House of Representatives, the state legislature, that would probably sign off in a heartbeat on a sensible piece of legislation that provided for back-end services like inpatient beds, like detox, like housing. And I just wanted to add that I texted Brian Thane, who's the executive director over at the Bellingham Housing Authority. 14 of the units at Samish Commons are homeless upon entry housing, basically. So we're building that capacity, but we know that a lot of this stuff takes a while, and it's very frustrating because people are suffering right now. But I think that this was a bold move out of the prosecutor's office in a really, in the most positive way I can characterize. I think this was like forward thinking. To get that many slots for behavioral health was needed. And I know that we, the city, are going to be asked to probably fund some of this stuff later. Sign me up. I will vote for it. I think it's a worthy cause, and just wanted to commend Eric and Vanessa for just all the work that went into it. There was a ton of work that went into this. So thank you. Appreciate it.
What's going on is so terribly important. It's very exciting, but also I think it's important for this what we're learning today to be conveyed to the organizations that are really concerned about diverting people from jails and providing these resources. I don't know that they know what's going on. And this is a subject we've been talking about a lot, about how to get the information that and the changes and the opportunities that are coming up for people in the community. They've got people out there have got to know about it. So I don't have the answer for that. I only know that it needs to be centralized and it needs to go out regularly so that, well, of course, we can show our appreciation for the people who are doing this work, but mostly so that you can all be rushed by all the referrals and need to build more resources, because that's the truth. The truth is what we're doing is on a small scale still, and so much more is needed, and there are just all these gaps to fill. And I mean, personally, I have communicated to our new representatives my opinion about what the gaps are and what we need. I would rather have that come from the whole task force. But since I've been trying to get this to happen for a really long time, I just didn't wait. I just went ahead and put my list down and sent it to people individually. And I do believe that there is going to be legislation coming from the state, but I also think that it's going to come from money is going to come from the federal government, because mental health is on Biden's list. And I don't know when that will happen, but ultimately it will. So this is very exciting. I'm very grateful for what's been done. I feel really emotional about it, because for so long it was just a voice in the wilderness. And well, it's like a dream come true.
I just want to add something else. I've heard a number of you talk about things that reminded me of what's going on in mental health court these days. And I don't know if you know this, but there's a change in leadership there. Linda Grant is retiring, and in fact, she may have already retired, and they know that they're looking at hiring someone new. Linda was a stickler about who could and should be in mental health court. And, that may have stopped some folks from getting involved in it. I'm not exactly sure. I just wanted you to know that there's a change in leadership. And, if the task force wants to have a stamp on, who's hired or who's going to be replacing Linda Grant, it might be time to take a look at that. Just want to let you all know that that's here now.
Thank you for that.
Is Bruce doing that hiring, Eric?
I would assume so.
I wanted to comment really briefly and then wrap it up so we keep respectful of Eric's time. So I'm sure you've got other places to be, but there's riffing off what Heather said about divert to, thinking about what Arlene just talked about, that this is small, but incredibly surgically precise, I think, in terms of who it's helping. So small, but targeted, I think, can give us great effect. And I'm going to put on my housing hat and take off my co-chair hat. I've thought for a long time that we should have dedicated housing resources to individuals, and it can be small and it can be targeted. And I would love to see a discussion in this group, and maybe the steering committee too, about what it might look like to craft a recommendation. What groups would we want to see? And I'm thinking lead and grace participants. So one of the things that my heart goes out to those workers, it's really difficult to work with somebody who's homeless and they're still making progress, which is amazing. But it's also like working, it's like being in a three-legged race, right? I mean, it's like, yeah, you're doing awesome, but if we took that off and you could each run, we'd be doing that much better. So my thought is this, Governor Inslee made a very publicized announcement about racial equity and about putting forth programs in our state that are going to be targeted, so if we are marching to that same drummer by our racial equity work here, can we target individuals receiving intensive services for housing services that go along with that as part of that targeting? And can that be a way for us to redress what's happened in a racialized housing industry? So I just want to throw that out there, because I think I think it is time that we make a recommendation. That is something this committee and task force can do. And I just wondered really briefly what you all thought of that, especially Eric, because I imagine you'll have to go soon. But what would that look like? And if you did have some slots, what would you want to see in that?
Well, listen, I love the idea of having housing for lead members and grace members. I think that'd be fantastic, because I think that's that would help people get out of the places that they are and hopefully do better for themselves and actually, protect our community. I think you mentioned, I think I heard what you said was that you're looking at considering race in that. Is that right?
The idea of targeting groups who are either underserved. So yes, it could be in keeping with that, possibly. Yes.
Yeah, I guess I'm not ready to really comment on that. That's it. It sounds like a great idea. I don't know if I'm ready to comment on that. I'd love to see something like that happen, but I don't know the answer to it.
Sure. But I think in general, having it for participants who are unhoused would be
Yeah.
extremely helpful.
Perfect.
Mike, one last comment on this. I came in late to this meeting because I was in a series of meetings. I'm on the Board of Commissioners of the Housing Authority, so I appreciate Dan's communication with Brian Thane there. One of those meetings was an informal discussion with the staff, and I raised the possibility of the Housing Authority assisting with housing that dovetailed with the task force's work. And they mentioned how underutilized their ability to fund shelter plus care vouchers for housing. They need case management partnered with that. They have a hard time year after year after year utilizing the money they have available. And it's a case management bottleneck. And I said, can we work with Grace and Lead and some other connections that the task force is developing? And there are conversations to be had there. I'd like to follow up with probably all of you and a couple of other people, Melora, perhaps, and see if we can put together some conversations that start to take advantage of existing resources. Resources are usually the problem we have. And if we're not even making full use of resources that exist, I think that's could be some low-hanging fruit. And I'd like to see if we can start to move forward with some of those conversations.
Great.
That's an outstanding suggestion. Those, the Opportunity Council partners with some of those, and the person needs to have a verifiable disability, and the Housing Authority is focused on mental health disability. I'm guessing, though, just from what I hear from folks running Grace and Lead programs, that should not be a significant barrier, that many of those folks do have those challenges and would have a verifiable disability. And Stephen, just to that, because at Opportunity Council, we participated in that work group, it was as many as 10 slots a year. Which seems criminal. I just want to add that there's another leg in that stool, which is the person doing the leasing. So there is case management. Yes, we need willing landlords, and then somebody to do some of the leasing work. But that is a great first step in terms of low-hanging fruit, because the dollars are here. They're federal. Yeah, that's a great idea.
The other advantage of that, I'll just say, is that the screening for eligibility to shelter plus care is a much lighter touch than it is for any other federally subsidized housing program. So I think the criminal history barrier that often excludes people from ordinary voucher programs would be less of a hurdle for shelter plus care vouchers.
This is an excellent idea. Eric, anything else you wanted to share with us, or task force members? Anything else that we wanted to pepper our wonderful prosecuting attorney with?
I'm good, thanks.
Thank you so much for coming on short notice, sharing information about the program. And I know you didn't tell us about any barriers that we could be helpful with other than housing, but you can see this group's interested. So if you do come upon some that you think this group could be useful for, please let us know.
Okay, great, thank you. Heather, did you raise your hand, or are you saying goodbye?
No, I was just going to add one more thing, that the prosecutor's office had a really great panel presentation on LEAD for a number of community leaders, for people in law enforcement. And I think there's plans to do a repeat presentation in January with the panel to share more with community members. So if you missed that one, we'll make sure you get information about the next one. And we're still in the process of just editing and posting that. So if you wanted to watch it, you certainly could. But I think it was well received, and a lot of great work from the prosecutor's office went into that. So thank you, Prosecutor Richie and Vanessa, for that too.
Great. Thank you.
Thank you. Jill, would I be able to persuade you to put that agenda back up for us again?
Sure, just give me one
Great.
sec.
I don't have to go over a failing memory. Okay, so as you can see that we have moved up number 4. So let's go to number 2, which is the committee meeting schedule. Dan, you want to cover this for folks, or you want me to?
No, go ahead.
Go off my best memory. Okay, we looked at our schedule, and obviously this group has been meeting on Mondays ever since I've been a part of it. So some of you all may have been a part of this longer than me. We looked at moving our schedule to Tuesdays. And part of that is, we have to adjust many times because of holidays. Good problem to have, but still we're adjusting our schedule. And so on the schedule, Behavioral Health Subcommittee is always at various Mondays. So Dan and I took a look at this together with Jill, who was really helpful. And we talked about doing it on the same day as Legal and Justice, but in the afternoon. So Legal and Justice, I believe, Jill, is meeting the second Tuesday of the month.
Correct. At 11:30 a.m. to 1 p.m.
So we were going to advocate moving the Behavioral Health Subcommittee to Tuesday afternoons at 2:30. Jill, did I get that right?
Yep.
Okay. Another thought that we had is, this group voted to meet more frequently, and for a while we were doing twice a month. That is a big ask on people's time, and I think sometimes we have discussions that go longer. So we brought the idea of doing once monthly, so reducing the frequency, but for an hour and a half. So I just wanted to introduce the idea, so reducing the frequency, extending the length, and changing the day. And just to get people's takes on that, how would that work well? Is that bad? So just popcorn style, any thoughts? I like it, I don't. I got a thumb.
Is it 2:30 to 4?
It would be 2:30 to
4?
It would be 2:30 to 4 at an hour and a half. Yeah.
And is it always the second Tuesday?
Yeah, barring some other conflict that I can't foresee, but yes.
Yeah, so that conflicts with another meeting for me, but
By how much?
let's see, it's from 1 to 3.
Okay. So you might miss like maybe the first half hour or so.
Yeah, if it was 3 to 4:30.
Could take that under advisement. Any other thoughts other than Arlene's? I got 3 thumbs. I got 1 partial conflict. Mr. Haley, any thoughts for you?
No, I can make it work. Tuesday is an easy day meeting wise for EMS. Wednesday and Thursdays are my more heavy loads. If you're landing on a Tuesday. Yeah.
And Megan, I saw it or not.
I will caution council day though. Actually, that bit me on a meeting last week. Tuesday is pretty, and same for Monday for Bellingham is a council day. So that is one day that would conflict.
I will confirm Tuesdays is a county council meeting day, and Legal and Justice often is that same day. I do coordinate with the clerk of the council on when she schedules meetings, if it's going to involve members of the Legal and Justice Committee. She'll often schedule those council committee meetings either later in the afternoon or early in the morning, earlier in the day, so they don't have a conflict. But that might be a little more difficult to do if we have 2 meetings back to back on a council meeting day. So that is another consideration. if the afternoon doesn't work, then there's also maybe the option of doing a morning meeting, say from 9:30 to 11, if that works better for folks' schedules.
Well, I'll go first. It's better for me. I'm a little more bright-eyed and bushy-tailed in the mornings than I am in the afternoons. But any other thoughts, Arlene? I know you had a schedule conflict in the afternoon. What does that look like?
I'll do it.
Okay.
I would opine that I consider Arlene one of the core members of this committee, and I want to be as flexible as possible with her schedule.
I'll come early. It's all right. I just like to whine about it.
I think that's your due. Anybody else have a serious challenge if we did the same schedule frequency, but we started at 9? Heather?
I have a standing board committee meeting on the second Tuesday from 9:30 to 11, but I could join for the first half hour, and also we could find somebody else on the task force to take my place. So
I don't like that option either.
Would
What
it help if it,
about the 3 to 4:30? Is anybody object to that?
Works for me.
Heather?
I will say the third Tuesday, if there's any reason, the third Tuesday I'm wide open. It's just the
That would
second.
be good for me too.
I was going to say, why it doesn't have to be the second Tuesday.
It wouldn't. No. We were thinking conventionally because we do a quarterly combined. No, I'm sorry, it's not quarterly, semi-annual combined with legal. So if it was the same day, but there's no other reason to drive it to the second Tuesday. The third Tuesday is actually better for me as well.
Yeah.
If we did the third Tuesday, could we do that? Would we want to do morning or afternoon? Because it sounds like now we'd have flexibility, at least for the humans on this call. Morning, afternoon preference?
I'm super flexible.
I think you get more bright-eyed, bushy-tailed in the morning. Afternoons we get tired, I think.
Yeah. Arlene, what do you think about that 9 o'clock on the third Tuesday?
This is the big joke in my family, so just ignore me.
Okay. So I'm going to just make this, just bring this up one more time. So it would be third Tuesday meeting at 9. So it'd be 9 to 10:30 on the third Tuesday every month. Lots of nods. Jill, let's go ahead and propose this. And if we can, if there's not a problem in that first time in January and we can set it, then I can reach out to Melora to do a little digging. And maybe we want some nuanced questions since we just got a lead update. We'll make sure it's valuable.
Okay.
All right. We've successfully changed our meeting schedule. Thank you all. And Jill, would you flash that up one more time? I think we're just on racial equity and data left for the remainder of our time. Just make sure that's cool. And we can need to leave a little time for public comment. Okay. So very quickly, when this group, and thank you, by the way, for supporting using a racial equity toolkit, I am hearing movement in the community that the county itself may become a GARE member. That would give us some outstanding support. I just wanted to offer that even without full membership, we can still implement this. And figuring out how to do will be part of our challenge. And it's something I offered too during steering to other committee members. If they wanted help in it to just noodle around or see how we might apply it, let's do that together in concert and offer to consult. Again, when I brought it up to folks, I was real honest. I'm not an expert. I haven't used one other than informally. However, that's not a reason to not do this. I think we could still be very effective with it. But one of the key parts, if you remember about racial equity, is you have to know a lot about data. You have to know who you're serving and not serving. You have to know what are their attributes, what demographic attributes do they have? You're not going to know if your system is failing a particular racial subgroup if you don't know the person's race. So Index Committee with Caleb is back and is up and running. And one of the reasons that this is on this group is, and maybe people with more history in this group would know more about this, but I know sometimes some sheriff system won't capture this, or it won't talk to the city of Bellingham system, which captures this. Being on the Commission Against Domestic Violence, we run into issues with data and trying to reconcile between maybe a tribal system that reports this way or this other system this way, and it's really challenging. So as we enter in 2021, thinking about how we're going to make moves to better operationalize racial equity and racial equity thinking and frameworks, it just occurs to me we're going to need some data. But what would that be? What are the data elements that we think as a group we would really need to know? And number two, because there's a lot of wisdom in the room, are there systems that we're already aware of that we know need to be adjusted? And I'll throw that out to this group and see, because I know there's some wisdom about people that have been working in criminal justice reform for some time. And I'm curious what you all already know.
Hey, Mike, actually, I'll kick that off if you don't mind. So we've been working on this a little bit over the last 6 or 7 months. Data analyst Jeremy Morton works out of my office, and we've been implementing a program called Gelada, which is a sort of hub and spoke model. And a lot of that work that's been going on right now is to identify some of those elements that you're talking about. So we have just finally gotten some basic connections with jail data, with Bellingham police data and the sheriff's office data, and we're working to kind of pull all that together and understand what it means. And you're right, there's a lot of information that goes into how the officers code or write up their reports and how those things are expressed. And those data points have been sort of difficult to pull out because of the different systems. And so right now, there is a good bit of work going on sort of identifying that information, seeing how it sort of crosswalks across those different agencies, organizations, and then trying to put it in some central repository to be able to ask or answer some of the questions, especially on the racial equity piece. But it's all those things that kind of go into the big picture of any given person that may, for example, come in the lead that we're trying to get this information or target certain populations, et cetera. So I would be glad to bring in at some point to the group Jeremy Morton and maybe give a high level presentation on where they are now. Because the higher issue really on all of this, and this is something we've been talking about in several committees, is that a development of a community information exchange and be able to share a lot of that information across the other sectors, because it's not only just BPD and the sheriff, it includes our partners out at Lummi and their law enforcement, as well as up in Linden, et cetera, et cetera. So if we can figure out how to make a community platform to bring all that information in, it'll take us a long ways. But I think we've got some foundation for it in this Gelada platform, and that's what this sort of meant to expand and share all that. So I'm hoping we can get there in a bigger way through sort of this idea of a community information exchange or health information exchange.
Seeing some nods from the co-chair too. I think that would be extremely valuable. It also sounds, and I just want to make sure I heard you correct, that this person has also done kind of some survey work to see what data is available. And that sounds like work that this group would have to remake, which seems crazy. That would be really helpful, Mike.
Yeah, I'll have him do that. It's been a huge learning experience. Of course, I'm not in law enforcement, so I don't understand that nomenclature. And yeah, Jeremy's done a really good job of sort of parsing that out, the EMS nomenclature and how we code data, total medical sort of aspect, if you will, where law enforcement data sets are totally differently focused. And once they are integrated, you get a pretty big story there on an individual when you can map all that out. So I'll get him prepped for that, and he can do a high level for this group to understand where we're going. And I think it'd be supportive for all of this group to hear, because as we work with the data analysts in the other departments, it gives them an idea of where we're heading with all this. Because we ask for data and they just, okay, well, here's some data. They don't know what we're really looking at. So it'll be helpful for that group to learn what we want to know.
I didn't see any hands, so I'm just going to comment too. Oh, Stevens and Heather's. Okay, let's do that first. Stephen first, then Heather.
Sorry, Mike. I'm pleased to see both Arlene and Ann on this because I wonder if the North Sound Administrative Services Organization would have some anonymized data that we might have access to.
That's a good point. I'll reach out to the ASO or have them do that and see if there's some templating in there or some basic understanding of that. Yeah, absolutely.
Heather, did you have a comment too? And welcome, Margot.
Margot says hi. I think about it from the community perspective as well, and like the vision of a community dashboard and what kinds of things just general community members would want to know. And just some questions I have, even in the work, it's hard to find some of the data sometimes about how many calls to the police are mental health related issues. With our programs like Lead and Grace, how many people are being diverted from the jail or from the criminal justice system to case management or to treatment? What are the outcomes for the people who do receive treatment or support? And even the really sad, awful stuff, how many people are dying because they didn't receive treatment? Or the basic, how many beds do we have in the community? What's available and what are the wait lists looking like? So we can start to get to, I think, and I'm sure I'm looking at Ann Deacon's screen, I'm sure you have a lot of this at your fingertips too, Ann, so that we can continue to build what we need to build and or support the current programs that exist that are really successful that might just need more capacity. And I'm sorry because it's the time of the day when this room makes me look like a Smurf, so I look blue sometimes. So just gonna acknowledge that for the Zoom room. But those are some of the data questions that I think would be great to answer from a community perspective.
This is Ann. We answered some of those in presentations to City Council and County Council not too long ago, within the last month and a half or so. And I guess maybe the question for us is, how do we get that information distributed widely, consistently, often? We don't really have mechanisms for that, but I think that's really what we need. We have seen really phenomenal success with the GRACE program, exceeding most of the other programs nationally that we've studied. For us, that's great, but how do we tell people that? And how do they hear it? So I don't know those answers, but I think that's more an issue for us than the data, because we're collecting the data now and we are going to continue to collect it. And that's also what we use to initiate quality improvement protocols so that we continue to improve our programming. So if somebody's got the answer to that one, I would love it.
I don't have the answer, but Mike Hilly and I are going to be meeting here in the next week or two. I have to look at the calendar. I forget when we made that time to meet, but it's specifically to go over how we do outward facing communication on the things that you just mentioned, the success of GRACE. Heather, you brought up community dashboard. I think that there is no centralized place where you can go and see how many beds are available, or or the lack thereof. So I think that's something that we'll be talking about that and a host of other issues. What I'd like to do is to put on the next agenda for this committee is for Mike and I to report out what we came up with for ideas and get some feedback from y'all, and then keep moving forward. My understanding is that Jed from the county can help us, and then I think Janice Keller from the city might be able to kind of help a little bit as well. There's a possibility of an outside consultant. I don't know what that looks like, to be honest with you, but that is one of our biggest challenges. This work is virtually invisible to the community, and it shouldn't be. There's so much of what the community has asked us for, we're working on. And we're doing it, but you can't see it. So unless you're available at whatever time it is right now on a Tuesday afternoon, it just, So I hear you. And then as far as going back to the gear piece, I think we need to overlay whatever projects we're working on with that, with those 6 questions that are in the gear section 5 of that report, because that should be aligned with everything we do, in my opinion.
Thank you, Dan, for reiterating that. That's a really good point. The piece I was going to add too, and where maybe Mike's offer of bringing the analyst who's been looking at all those systems, when Jill shared with us last meeting, guys, or I think it was in the meeting of the whole, the stats from Wendy from the jail. And if y'all remember, the federal government changed a rule on capturing Hispanic. Well, as soon as that happens, right, if we don't think about that in our own community and say, you know what, we still care about that, we're going to capture it anyway. When we don't do that, what happens to our data is we get little stars on the columns that you cannot connect them over years. And that may sound like minutia, but you know what, in what we're dealing with, when you're talking about equity, the minutia is really important because people are lost in that data. Their stories are lost in that data. And if we aren't asking the right questions, so I'm particularly interested, Mike Hilly, in what that analyst might tell us, like, well, where are we not capturing it? Because one of the things that I think we can do is we can affect process too. So it's not just what's available, but if we're not capturing it, what might the process be to make it more uniform, to make it regularly available, or to capture it in the first place, even if the feds don't make us. So Dan, thank you for your suggestion of putting that on another agenda topic. And we're interested to hear that report out. Guys, in the interest of time and trying to be a decent chair, I want to be cognizant of we're at that meeting end. Jill, do we have any attendees that we should open up public comment for?
We have 2 attendees. If either of you would like to speak to the committee, please virtually raise your hand at this time. And no one is raising a hand.
All right. With that, any parting thoughts, words? We'll make sure to put out the new schedule to all the other folks.
It looks like somebody did raise a hand.
Okay. And that would be Reese Taylor. Reese, please go ahead.
Hi, it's can you hear me?
Yes, we can hear you.
Oh, super. I really appreciate how great your website was. The whole task force, the whole what do I call it? IRTF, all the letters task was on the website so that I could find this meeting. A lot of them aren't happening until next month. I really appreciate what you guys are doing. And mine was in direct response to something I found on Facebook, which was a community to community group that is a human rights action group that I've been off and on involved in for years. But talking about just, they were really upset last night about the police budget in Bellingham coming out and how it didn't really, how so much money is going into the police, but isn't going into racial justice. And so I immediately thought of you guys because I have followed this since the jail vote years ago. I've been trying to follow you guys, and I really appreciate listening to you today and seeing how much progress you've made since I tuned in probably almost a year ago now. But I'm also completely hearing what you're saying about how you need to get to laypersons like myself with numbers and facts and just showing the progress you've made in a in terms of how do we all quantify it all, quantify the progress we're making as a city, as a county, because you guys are county, and I'm Bellingham. I think that that those of us, people like me, and I'm not volunteering for anything, so I didn't put my hand up for that. But you know, I have noticed that there are lay persons on different boards periodically, and those people help. I think Heather's kind of shaking her head, you know, maybe to figure out how to communicate. We have so much social media going on right now that it shouldn't be that tricky. It's just that, and we need some coordination on what's, you know, what you all recognize as the best way to get to people like me. I just happened to have my foot in the door a little bit, so I got in. But I'm going to share it with people around me, what you guys did today, for instance, and there, and I'm also maybe going to go to a city council meeting and mention it, just so there's more people taking advantage of how organized you all are and how professional you all are. I really appreciate it. Anyway, rah, 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 go, go, go. Cheerleader from the background. Anyway, that's it.
Thank you so much for your comment today, and thank you for your presence at our meeting. It's much appreciated. Jill, is
My
there,
pleasure.
is there anybody else that we've got with a hand up?
I don't have anyone else with a hand up at this time. I am going to just take a minute, if you don't mind, and plug to Ms. Taylor that the task force and committee meetings, the video of these virtual meetings is also now being posted to the task force YouTube webpage. So I just want to remind everyone.
Okay. Thank you.
All right. Anything from any of the membership go to the order before we close? Okay, if not, whatever holidays you may celebrate or not, and for those in our community who have less and may not be celebrating, let's keep our minds with them. But I hope everybody is happy, healthy, and safe. And this group won't meet again until 2021. So have a safe new year. Thanks.
See you next year.